Okay, so now let's talk about the splenectomy in this next video. So, again, we're gonna start with our basic scheme. So first thing first, we need to know the causes of the splenectomy. So basically not the causes, we will say the indication of splenectomy, and once we have those indication, we are gonna do the examination, rule some of them out, and then after that we will have our differentials, upon which we will discuss that with the examiner. So that's what just basically this station will be. So here is a freebie for you guys, the indication of splenectomy. So far mostly it will be related to some hematological condition. The far most important that you will have to know is the hereditary spherocytosis, because this is one of the indications that we are still doing splenectomies. Otherwise, for the other condition, basically now we have a lots of medication, so that splenectomy is not that much common for those conditions. But you do need to know that if the patient is if it is an elderly patient, you can still find out that they have this splenectomy. So you need to know the indications of it. That would be autoimmune hemolytic anemia, hereditary spherocytosis, idiopathic thrombocytopenic purpura, thalassemia, and sickle cell anemia. Along with these hematological conditions, you can also have some neoplastic conditions such as lymphomas and myelofibrosis. So splenectomy may also be done in those cases if the spleen is causing a lot of trouble. Along with that, it can be due to the trauma, but usually in the cases they don't usually present the cases that have the traumatic splenectomy. But just bear in mind that if the patient has trauma, then he or she might also have splenectomy due to that traumatic splenic rupture, and in those cases usually the scar you will see is mostly the laparotomy scar rather than the elective admission of the splenectomy, which usually has the subcostal scar, which we will discuss shortly. And it in rare cases could be due to some infectious causes such as splenic abscesses as well as hydatid cysts. So just keep these causes in mind. So if you do have all these causes in mind, you will know what to look for when you are doing the examination, and then we will proceed with our examination in the same steps. Just a brief overview regarding the scars that you could find out. So just know some of the scars that you could find out. Basically the medicos are not really aware of the scars, so just keep in mind. So if the patient has subcostal scar like there, so this subcostal scar will basically means that the patient had some splenectomy. This is usually done for the splenectomy, and that is elective splenectomy scar. If the patient had the not the open splenectomy, but rather had the laparoscopic splenectomy, so you could see those small scars there and one in here as well. So those three are basically used for the laparoscopic splenectomy. Also in these patients, so whenever there is a splenectomy, so we all know that it's mostly due to some hematological conditions, and those hematological conditions tends to increase bilirubin, and those tends to cause the gallstone. So bear in mind, also look for the scars of the cholecystectomy as well, which in case if it is laparoscopic cholecystectomy, so you will find one small scar here, one here, and one here. So just bear in mind the scars of the cholecystectomy as well as splenectomy in these patients. Now once you all have that knowledge and the basic idea what you need to do, let's dive into the case. So here we have a case, the patient lying, you enter the room, it's an abdominal examination station. The first thing you do is the general impression or the general inspection. You go to the foot end of the patient, you look at the patient, you look for any pallor, you look for any icterus, jaundice, you look for any scars, just briefly, so that you get the idea. Again, it's just that you are in the PACES exam, in all of these cases you are just like a detective that is going to solve the case, find the diagnosis. So you have these 7 to 8 steps, and in each step you gotta find out something, and then you combine all of those findings to reach to your diagnosis, to reach to your culprit. So detective, at the start in the general impression you see, okay, youngish male, that is a bit anemic, a bit jaundiced as well, laying down. Okay, then you look, okay, there are a bit of scars there and there as well. Okay, in the same way, if the patient is African American and you know, he or she has those scars, then bear in mind that these African American people have sickle cell disease predominantly. So yeah, just keep those in mind as well. Or African British people, so they will have the sickle predominant disease. Then next you go to your hands. Your next point is looking at the hand. So the patient might have koilonychia, don't, because of the long-standing hemolysis, this patient tends to have the iron deficiency anemia, so they will have those spoon-shaped nails. Don't miss those out. Always explain if the patient has those to the consultant, so that you know you have picked out the findings. Also look for any bruises. That is going to be in the case of the ITP with the low platelets, any small purpura, you can find those things out. Otherwise, the hands and the forearms may be pretty normal in these cases of the splenectomy. Again, if the patient is sickle cell, you may find out some of the needle marks or a bit of bruises, because these patients are very difficult to cannulate, so you may find out those as well. So that's your second point. After going through those, then you start with the face. So basically in the face you may find out the jaundice, a bit of jaundice, or the icterus. Otherwise pretty normal findings in the face. The same with the neck and axilla. Always look for the lymph nodes in these patients, because if they have lymph nodes, then it tends more toward the malignancy, because yeah, the hematological conditions can also the malignant hematological conditions also present with the splenic problems, and then we can also do the splenectomy in those cases as well. So bear in mind those cases. Then chest and back, so mostly it will look normal. Again, if the patient had some consistent liver along with the spleen problem, if the patient also had some liver problems, then you may see the problems of the liver, the chronic liver disease such as gynecomastia, spider nevi, loss of hairs of the chest. Otherwise it might be fairly normal. Again, also look for the scars of the chest drains, central lines, that would show that the splenectomy was mostly due to some trauma. So again, you have to find out all these findings. You have to make a sense at the end that what it could be. So the more you find out the findings at each of these stops, the more better your differential diagnosis will be. Coming to the after the chest and the back, you come to the abdomen. So again, in the abdomen, first of all, on the inspection you look for the scars, then you're trying to palpate. Then the patient may have compensatory hepatomegaly, or the patient may have the gallbladder, palpable gallbladder due to the repeated inflammation or large gallstones. So it might be there, but also look for the scars of the cholecystectomy. Don't miss those as well. Then again, look for the signs of the liver failure as well, such as the ascites, caput medusae, flap you have already seen in the start. So anything in the abdomen of the diseases of the spleen as well as the liver. Along with that, palpate for any masses that could help you in some malignancies as well. Also look for some scars for the biopsy drains or laparotomy scar, which may also be present. Again, if there is a laparotomy scar, then it may also indicate that the patient had some traumatic splenectomy. So that's all in the case of splenectomy. You go to the feet. Yeah, so in the feet you can also look for the pallor of the soles that suggests anemia. Other than that, you can also see if the patient is sickle cell or some other hematological conditions. They usually tend to have ulcers over the legs as well, so don't miss those out as well. Also look for the skin pigmentation, which is usually seen in these hemolytic conditions. So once you are done with all of those, you picked out that okay, the patient had normal other examination, had just splenectomy scar, is young, and you find out the patient is a bit anemic as well, so you tend to go more toward that it might be, autoimmune hemolytic anemia, or the hereditary spherocytosis. After explaining all of those, going through all of these, memorize these conditions and also the management and the further investigation, how to separate all of these, how to narrow them down again. So that will be your discussion. So for the discussion purposes, you need to memorize these causes and all of these investigations, their management plan, and everything regarding these conditions, and you will be golden in a case of splenectomy. Okay, see you in the next video.